want to talk about?
Why you're here. That's what it's all about.
I'm always here.
Yeah. I always eat candy right before every single session. That's why people call me the candy man sometimes. Actually, I have a tattooed across my chest, but yeah, I do. Candy man right across my chest. But all these videos here,
That's my next tattoo.
all these videos here that I make inside the torch room, I just want people to know why people show up to the torch room, why people come in raw, unedited, just so people get an understanding of what massage therapists have to go through. It's not always scheduled. It's not always, I don't always know what they're coming in here for. So the session's all about the client, what they're here for. And I just want to be surprised with some condition, something that's gonna say, what the fuck can I do today to show you how powerful massage can really be.
So biggest thing for me today, I don't know if it's diagnosed sciatica, but I always have a low back issue. So we're going to work through that. I actually just had a septoplasty where they do your work on your deviate septum. And go figure, I went to the doctor, they put the IV in my hand, and I'm still feeling effects from it. This is almost about 2 weeks ago. So after kind of briefly talking with Miguel, he's going to kind of work through the forearms a little bit. Because definitely it's getting better, but it feels almost like a bruise, like even soft to the touch, like it hurts.
Yeah, I was going to ask,
still
what
a little
does
bit
it feel
swollen.
like?
You can even tell the veins are a little bit raised, everything like that. Basically, it feels like it's like someone either squeezed my hand really hard or I hit it on something. So definitely want to work through that. And then just in general, I'm trying to get my mobility a little bit. So maybe work on this forearm as well. And then always just shoulder mobility, probably be the biggest thing today. I have taken about 2 weeks off the gym, so I'm not necessarily worried about legs. Legs will probably be my next thing, but definitely low back and the forearms and shoulders, I think would be good.
The low back, but you don't feel anything like down the leg or nothing like that?
Not down the leg. It's mainly when I sleep, and then certain positions, it'll be right there, just right above the glute.
Okay.
Yeah, and it's just a constant it's like maybe like a 1 to 2 pain, but it's very discomforting. So trying to work through that a little bit.
Yeah. And a lot of people always think, because everybody will self-diagnose themselves saying, I've had sciatica, or a friend has had sciatica. I have it in the same general area, and symptoms can kind of like mesh together. But sciatica has very distinctive symptoms where it can be very, very painful. It can stop you from moving. Different sensations can go down the leg. He has it very localized in one area, but we know he's an active bodybuilder. We know he's in his growth season, pushing a lot of weight. So I have to take it for what it is. So we're gonna assess the muscle that way and then see what's really going on. But we'll always treat it in that fashion. That he said sciatica, so we're gonna look at that. Plus look at other things to see what we can do about opening up hip mobility and take away the tension. So, but yeah.
It does tend to shoot down my leg when I'm driving, just not recently. Recently, it's just literally just been in that one spot. But I've also had to sleep differently because of my surgery and everything like that. So I think that might be aggravating it as well.
Yeah. All right. Another surprise session. We'll see what we can do today. I don't even know if I can help him, but we'll see. We'll see.
Better.
I better. That's the pressure. That's the pressure that gets put on me. I better be able to. Doctors can't even help him, and he wants me to.
No, the doctors are the ones that did this.
That's probably one of the biggest things is when somebody comes out of like a doctor visit, a surgery, something, and they're like, they kind of feel bad just for a short while until things start getting better. And some people will turn to massage therapists. So now we have to like analyze all this situation, what happened, and then what he's also doing on his day-to-day thing, because you're still going to work.
No, so I've been off. I've literally just haven't.
Oh man, must be nice. Some people take time off, but you were in here training.
With a 25-pound weight limit, yeah.
Yeah, and you were training arms today, if I saw correctly. Today was arm day, and he's having trouble rotation of the forearms. So go figure. Let's just stress everything out before you come into the torture room.
Hey, that's what I'm here for.
But we already know what we're gonna do. That's how quick I can analyze these situations. I already know what I'm gonna do just by hearing him talk and what we're doing. Plus, we've been doing a lot of work together. Also,
at least it's been like 2 years almost,
I
think.
Yeah, but we are gonna start with the arms. And mostly that forearm over there, that left one, and then we're gonna get down to the leg. And which side was it? Were you feeling it? The right side? Yeah.
Because even now standing here, I feel it. So
sounds good.
Yeah.
All right.
Cool.
Let's do some work. And with this forearm, after the IV was put in right in this vein, and the skin feels different from this arm to this arm. The skin feels so different. So, and we know there's good circulation. You can just tell just by the palpation how it gets a little bit of white and then the color comes right back. That's how we know there's good circulation. But the sponginess that I'm feeling in the skin, we know there's some stagnation in there just from the lymph. So this, nothing too crazy. We're just gonna push fluid all the way through and see if we can get it to just dump off in that lymph node right up here underneath the clavicle. Yeah, and this is just pure lymphatic drainage here. That's all we're doing, because just the touch alone feels bruised, so there's no reason to like traumatize the tissue with scraping or deep pressure. Yeah, we just need to push that fluid out of there all the way through. Now, if you have like a Theragun at home, you can do this yourself, very, very light, by activating lymph nodes here, then working around the outside of the bicep, and then working on the forearm, and then going right back up. Let's get a peek of this tattoo. He just got this done. When did you get this done?
Tuesday, I just finished it.
It's Tuesday, it's Thursday, so 2 days ago.
6 hours session.
Typically, to open up this shoulder mobility, which we're going to work on the shoulder, I would work right here, but should we? No, we're not going to do that. We're going to do that to you today. See, you always get caught up with surprises. I would typically work on the rib cage to open up that shoulder, and we're going to work on that here in a few minutes. But now I have to deviate my plan of how can we do this without aggravating the tattoo. It's always up in the air. What can we do? What can we do? Always have a contingency plan. So, but all right, since he has the tattoo there, what we're gonna do to open up shoulder mobility, we're gonna work on the upper fibers of the pec, the teres muscle, which is away from the tattoo. It's gonna be right through here. So we're gonna work here and here, because there isn't that much limitations, but he wants good mobility. So when he trains back to his normal training regimen, probably here in the next week or two, he can just get right back into it. One of the best tricks with cross fiber friction, because I do so much cross fiber friction when I work anywhere on the body, is tempo. So if you can manipulate the tempo, maybe going fast, maybe a little slow, but you can actually feel the tension of the muscle tissue change from second to second, where it goes from being sticky to pliable. And what it's going to do is it's just going to help assist me work on the next muscle tissue. So they start communicating with each other when there's movement. So it says, okay, we know we're going to be doing this next. So now we're going to get over here and then bring blood flow into the delt. The muscle we're really getting onto is that teres major, teres minor. So. See how nice it moves now, nice and smooth, even shows off the muscle there. Learning how to manipulate muscle tissue, even when there's obstacles. So always understand how muscle tissue responds with touch, how it is under stress, and how you can manipulate it to your best advantage when you come up with obstacles like this or anything else, because everybody's different, but he still wants the same outcome and goal, which is mobility and good blood flow and getting out there to train again. After relaxing the forearms and I'm reassessing like external rotation, something people just don't think about too much is that short head of the bicep. That gets pulled on the most, and you can feel it right in here. It gets pulled on the most when there's a lot of external rotation. So knowing that he's gonna go train, grab a lot of weight, wants to do arms, do everything else, this is why I go from forearm to bicep to shoulder, because the short head of the bicep does attach to the shoulder blade way up over here. So this is the main head that we're gonna get onto. Just because, again, on that external rotation right there, it puts stress on that short head of the bicep. And all we're looking for is just to bring pliability to the attachment point. That's it. And we want the muscle to respond very well to that. So he comes in here pretty frequently. So what's like twice a month, maybe, if that,
Yeah.
when you can fit it in, if you can 3 times a month. So we're able to stay ahead of the game and staying on top of stuff. But if he got no tissue work for, let's say, 6 months to 8 months, and then he came in with these same issues, it'd be a different treatment because things would be overstressed and we'd have to be just a little bit more aggressive with it. But we've been able to manipulate things pretty well. So the moral of that story is get your tissue work. Get your tissue work. So. And then the secret weapon right here. This is probably my favorite scraping tool because it's so versatile and I can use it for so many different just areas on the body. And I know the weight distribution, so I know how to make it feel light or very heavy. But this is the one guy that I like to get mostly when I'm going to work on the rib cage to help improve shoulder mobility. And the muscle we're getting onto here is called the anterior serratus. And it starts about right here and wraps all the way around, even behind the shoulder blade. But why here? A lot of people ask me why the anterior serratus. Is it helps with mobility movement of the scapula. It's what we call scapular delivery. So it's the opposing muscle to all the other muscles that stabilize the shoulder blade in the back. Then that's where people get most of the knots. You know, they say I have knots and tension in between the shoulder blades. This guy will be affected too because we still have to live our lives, do our day-to-day things, whatever it is. This guy is still constantly working. So this guy's always gonna be affected, but we scrape this guy up, that shoulder is just gonna open up and help me attack the muscles on the back just a little bit easier, so. When you're if anybody wants to scrape the serratus muscle, you definitely want to go alongside with the fibers. You want to follow it. So you definitely don't want to go against it. If you do, you have to do it very light, or I would switch up to stone, which doesn't traumatize the muscle tissue. But if you really want to work on muscle tissue and change the stress level of it, you want to follow the tissue. So that's number one thing. So many people will say they can do scraping and they're just going like they're coloring a coloring book and the guy just can't do nothing after that. No, the goal is to improve mobility and improve performance for him out there in the gym floor. So a little bit of pain for a lot more pain in the gym. And it doesn't take long. We're looking for the stretch. That's pretty good. Oh yeah?
Yeah, it's been aggravating me a lot.
Even though like this is the side that you have like the low back issues, somewhat similar to sciatic symptoms, you feel it the most when you do drive. We're just gonna work on this center quad right here. So every time, some people don't realize when you drive and you're pressing the gas pedal, braking that, every time you're doing this, the center quad muscle activates the most. Knee is bent, it's gonna put tension right here. And it like crosses past with that iliacus and that psoas muscle because the hip is flexed. So they just cross past like that. But every time you're doing this, that center quad activates a lot and just pulls on the hip and can cause tension back there. And if you've had pre-existing conditions like sciatica, really big time, it can just re-aggravate the symptom, but you don't have the condition. And it's kind of why we're starting here. So talk about this. So with somebody like that, who IFBB Pro has been up there at the best, averagely people will train, let's just say this much, and will only put this much into recovery, and that's all you need to. But when you can match recovery time the same as your activity time, somebody like Jay Cutler, who was doing 3 to 4 tissue sessions a week on top of chiropractic care and all forms of tissue therapy like neuromuscular therapy, deep tissue. He was even switching up his trainings. He would do like kettlebell training. His body and training was so versatile into what he could do. It wasn't just stress overloading the tissue. But eventually it caught up to him. All he came out with was one torn bicep. But he still trains to his level now, age level, and what he can handle, and he still eats really clean. He just didn't give it all up. So there's some people who do still so much training, let's just say 30 hours a month, and do zero recovery. Some people at the pro level will do 30 hours of training and do 10 hours of recovery during the month. And Jay was probably one that probably did 30 hours of training and 20 hours of recovery. And it was all different things. So he took it 100% what he could do. But I think it was because he knew who he was going up against. You know, he was going up against Ronnie. Yeah. You had to.
And then just the longevity, obviously, you see it.
So recovery time, it's not always doing manual therapy. It could be switching up your training for 2-3 weeks. But he has footage out there of him like training different ways, you know. So and the muscle I'm on right here, this is called the iliacus muscle right here. So just moving that knee in and out just kind of brings more mobility into the hip. The unique thing about that muscle is it attaches in the back of the leg, and it kind of is bypassing that sciatic nerve. So we're looking to just open up mobility of the hip. So when we get them turned over and we work on the glutes and the low back and the adductors, muscles know that, hey, this is a recovery hour. It's not like stressing anything out. You know, muscles are starting to relax here and there, but it's a sensitive muscle because it's an internal hip flexor. All the way down and I lift it up. Good. You feel it on the other side? Yeah. It happens. Sometimes you can get a lot of disruption on this leg and it aggravates the nerves on this leg. It just happens. And there's so many different ways you can treat sciatica. You can treat it by working on the opposite leg. You can treat it by doing trigger point on the affected leg on the calves, or you can manipulate soft tissue around the ilium and just the SI joint itself. So there's many different ways you can work on sciatica, but how it came about is always going to be unique and specific to the person. So working on the adductors, holding trigger point work here that's closer to the pelvic floor, releases tension off the glutes. So that's just gonna help relax those muscles in there and take off any tension it might be having that like kind of holding or pinching on that sciatic nerve. So I'm using the help of other muscle groups to help assist me relax the most affected area. So since all muscles play a role together, they communicate together. So I don't just always want to go for the affected area and just seeing if I can get it to submit to me. I want to use the help of the whole body to say, hey, let's get things to relax together. All right, we're gonna bring both arms forward, and then we're just gonna scrape right through here. Get that shoulder to open up even more.
Now I can actually breathe.
Oh man.
It does feel a little better.
We're gonna turn the light on, bright light.
Yeah.
Hey, you looking big, bro.
I'm getting tiny, I feel. It's the pump. That's what it is.
It's the pump.
You put all the blood back in the muscle.
So Eric's photo is way up there.
That's the old one.
I like to keep him farther away so no one sees.
I look down on everybody.
No one sees.
I'm at the top. You gotta chase me to get to the top.
He's also my best friend, so I give him shit all the
Finally,
time.
you admit it on camera. Don't edit that out.
So I like to give him shit. He thinks he's a bodybuilder, but
Trying to be. Honestly, I think because you're talking about the consistency, I feel like my shoulder mobility has good. Because even when you're messing with it, it's like not as tight.
But even when we met like a year and a half ago, and you like really started to implement tissue therapy, you saw the change from 1 year to the next year. How much thicker and fuller.
Absolutely.
Your body just moved. So.
And I definitely think with the doing it every week for the 16 plus weeks, I think we did 18, was definitely a game changer.
Yeah.
Especially this last prep.
Yeah.
And then same thing, I incorporated the cryo and all the other fun stuff. But yeah, tissue work, I like it. It works.
Yep.
Twice a week, off season, every week for in contest, if you can afford it. If not, don't bodybuild.
Yeah. Yep. He needs all the help he can get. So.
100%.
No, but recovery time is always something that people don't think about, but it's extremely necessary. And it's just not the stress of the tissue, but it's also the stress of like the mental stress, the social stress. Athletes, you put so much on yourselves, like, am I doing everything right? Am I going to be ready on time? Coach just says, just keep going, just keep doing this. This is also a time where we don't just always have to just like, manipulate the muscle tissue, but you can also just let it out. Sometimes just venting out what's stressing you kind of helps me work with the tissue as well. So it all plays a role together. So, but yeah, come to the torture room.